Going to work, there's always a sense of anxiety. You never know if you're fully staffed.
Our nursing staff are tired. Hospitals that are maxed out to capacity.
I'm concerned that this will get worse before it will get better, and it's already pretty bad.
It's a Friday night in Melbourne and emergency departments across the city are overwhelmed. Queues of ambulances are banked up with patients inside them desperate for a bed. These overcrowded waiting rooms look like the airport at peak hour as people wait hours for urgent medical care.
This is the most overcrowded that it's been.
George Breitberg has been an ED doctor for 40 years. He's doing emergency telehealth consultations to help people before they turn up to hospital, where some are waiting more than 12 hours.
How long has you had the pain for?
The ABC can reveal the number of Victorians leaving overcrowded emergency departments before they've even been seen has doubled in the past year. That's more than 800 people a day, almost 1/5 of all patients.
When you start to double the number of people that don't wait, we get a feeling that there's probably people in that group that should have stayed, and those people in fact have the potential to get sicker.
Dan Miles is doing better now, but he spent 10 hours in pain as he waited to be seen at the Austin Hospital on Saturday. He had a staph infection in his foot and his GP sent him to emergency. He says there were at least 60 people there.
Just one of those moments I was just thinking, this is pretty crazy. There's just people everywhere.
He had to go back to hospital on Monday and wait another 6 hours. In that time, his foot got worse.
By the time I saw the doctor, it was not in great shape.
Doctors say there are simply more patients coming to hospital than there are leaving. The number of Victorians staying in emergency longer than 24 hours has also doubled in the past year. Last month at one Melbourne hospital, 19 people faced a wait that long. Only 4 other people have had to wait more than 24 hours at the hospital this century. And in recent weeks, at least 2 patients have died waiting to be seen.
There comes a point where when you've been there for too long, it's dangerous. After about 6 hours, the longer that you spend in an emergency department, the more likely you are to die at 30 days.
The problems are not just in emergency.
The amount of nurses that we have lost over the past year alone is incredible.
Josh McCallum is a nurse in one of Melbourne's acute medical units. He says staff shortages are so bad, patient care is suffering.
People are going days without washes. People are missing their meds on time.
He says he dreads going to work with so many nurses sick and burnt out. Desperately needed beds are sitting empty.
We had nurses coming in on shifts just bawling their eyes out, and you check what's wrong with them, and they were considering self-harm, they were considering suicide.
The state government says its data doesn't reflect a doubling of people giving up on emergency care.
This is a very serious situation. That is why we're investing record amounts of people, of systems and infrastructure to get us back indeed ahead of where we were pre-pandemic.
I think the other longer term solutions are around making sure we've got the capacity in our hospitals and in our discharge areas in order to maintain the flow through the system.
I think this is going to take, unfortunately, years rather than weeks or months.